Yusuf. Today I'll be presenting my assignment 3. My name is Hashwin and I'll be representing my group members. My group members are Gayatri, Alia, Daniel, and Tenmuzi. So these are the contents of the first assignment, guide analysis. So guide analysis is a scientific study of human walking. Coaches and practitioners can discover players' posture, balance, stability, and injury issues by analyzing the guide cycle. The guide analysis phases are divided into two main phases, which are the stance phase and the swing phase. The stance accounts for 62% of the phase, and swing phase accounts for 38% of the phase. So, going on to literature review. So, the first literature review title was Effects of Obesity and Chronic Low Back Pain on Guides. And these are the years and authors and the aim of the study. And the second literature review was titled as Guide Cinematic Analysis in Morbidly Obese Patients. So, these are the details of the study as well. And the literature review, the third literature review, title of it was Guide Analysis Methods in Rehabilitation. So this is the detail of the study as well. And going on to the fourth literature review, the title was Measuring Ankle, Angle, and Analysis of Walking Guide Using Kinovia. So these are the details of the literature as well. And for the final literature review, the title was Guide Analysis in Parkinson's Disease, an overview of the most accurate markers for diagnosis and symptoms monitoring. So going on to the methodology, my group member, Gayatri, will present.
Okay, for the methodology, there were 5 in a team from Faculty of Sport Science and Coaching, which were made from 3 females and 2 males. And this data collection was conducted in Stadium UPSI, Sultan Azlan Shah. And also we used iPhone 12 with 12 MP camera system to record the video, and a tripod stand, and also a measuring tape to measure the distance from the camera and subject as well. And then for the software, we used Kinovia. Okay, next. Okay, so for the parameters and experimental setup, the video camera and Kinovia software was being used as well. And then the video camera was placed on level tripod at 1.2 meters, and then in the distance of 5 meters from the pathway. And then this is to ensure the calibration area covered by lower limb of the subject. Okay, next. Okay, for the experimental protocol, first of all, the participants were given the description of the study, which is the purpose and procedures as well. And then the group leader gave a demonstration for them to understand better. And then each participant were requested to walk in front of the camera at a normal pace. Okay, and then the angle measurement was being measured at 3 points of each person, which is the ankle, knee, and the hip flexion. And the data, finally, the data is stored according to the subjects and trials. These are the information of all the participants. Okay, that's all.
Okay, hai. Assalamualaikum warahmatullahi wabarakatuh dan salam sejahtera. Saya Dan Yusuf. So, ini adalah kutipan data daripada 5 orang subjek yang bermula daripada 8 fasa, bermula daripada initial contact ataupun heat strike sampai yang terakhir iaitu terminal swing. So, di table sebelah kiri kita boleh dapat lihat relative ankle flexion, angle for walking gait phase. So, dia tengok di bawah, kotak di bawah tu kita menandakan range di antara kesemua fasa iaitu max tolak min di antara 94 di fasa initial contact dan berakhir dengan terminal swing iaitu 90. Jadi di sini setiap subjek mempunyai perbezaan daripada angle iaitu pelvis, knee dan juga ankle. So di yang table 2 iaitu relative knee flexion, sama juga seperti dengan relative ankle flexion, cuma perbezaan di sini di range agak terdapat kurang berbanding dengan knee ankle flexion. So yang seterusnya adalah velocity of walking gaits. So di antara kelajuan setiap subjek yang kita ada, dan 5 orang yang paling terpantas adalah di fasa iaitu berikutan di fasa iaitu mid swing yang berakhir dengan terminal swing iaitu 4 di fasa yang ketujuh, dan average daripada kesemua ini adalah seakan sama iaitu 4 perpuluhan. Dan kita teruskan dengan discussion.
Okay, hi, Assalamualaikum. My name is Al-Mafira. We talk about the discussion. So as we know, these papers of main purpose is to analyze each subject's working speed as well as their ankle and knee angles. And as a result, the current studies findings and analysis concentrate on these purposes, which are associated to measuring ankle and knee angles using kinovia and walking speed. So in the table 1 shows the the mean measured relative ankle angle in degree of working gait cycle. So first, we have got the most peak values of knee flexion, which is in the initial swing, and also the swing happens from the limbs elevation to its maximum knee flexion, which results in all the subjects have slightly higher ankle angle measured during this phase of the gait working pattern. So also a graph was plotted that indicating the mean of the knee flexion angle of working gait phase from the assessment of all the 5 subjects as shown in the figure 4.
Hi, my name is Tenui. I'm going to talk about conclusion. The way we walk and run are referring to guide. If you can run without any issue, your guide can still be wrong, which could increase your chance of serious injuries. Monitoring a person guides help us to recognize their distinct movement, identifying regular guides pattern, and identify pain-causing condition and implement an access treatment to correct the abnormalities. Thank you.
So these are the contents for the second assignment, which is a spot motion analysis. So for the introduction, the importance of biomechanics involved in identifying optimal movement patterns to improve sport-specific motions. In this assignment, we will be analyzing the push technique in field hockey. The ball should be pushed if you need to create a brief pass quickly. The push is one of the most precise methods of passing the ball across that distance of 10 to 15 meters. So this is the first literature review. The title of the literature was Analysis of Biomechanics Slap Hit and the Push in the Field Hockey. These are the details of the literature review. And the second literature review was titled as Kinematical Analysis of Push Pass in Hockey. These are the details of the literature review as well. And as for the third literature review, the title was the planetary of the stick and arm motion in field hockey hit. So these are the other details of the literature review as well. And for the fourth literature review, the title was Kinematic Structure and Characteristics of the Drag Flick.
Okay, for the methodology of this subject, there was the same participants were selected for this subject from Faculty of Sports Science and Coaching, 3 females and 2 males. This study was conducted at Stadium OC, and then the camera that we use is iPhone 12 with tripod stand and also the measuring tape. The software we use to process the data is the Kinovia software. Okay, next. Okay, this was the experiment setup. A video camera was placed on a level of tripod at a height of 2 meters to the center of the pathway of the distance at 10 meters. Okay, next. Okay, for the protocols as well, it is the same. The participants were given a description and also verbal instruction, and also on a fixed position, each participant were requested to perform the desired hockey skill, which is the push twice with the motion, which is focused on the pushing the ball, and video being recorded as anticipated. Okay, next. Okay, the angle measurements were elbow and knee as well. Okay, next. Okay, this is the basic information of the demographic of the participants. Okay, next. All right, the result will be explaining by use.
Okay, thank you Gaya. So di sini kita dapat lihat bahawa result menunjukkan ada sedikit perbezaan kerana seorang daripada kita punya subjek mempunyai pengalaman selama 10 tahun iaitu hoki wanita, dan dan selain itu tidak mempunyai pengalaman langsung dalam bermain hoki. Jadi kita teruskan dengan table 1 iaitu relative angle in the prefix phase atau fasa ataupun drag bola. Di sini kita boleh tengok di elbow flexion dan knee flexion, yang kita dapati bahawa the range untuk elbow flexion adalah 32.5 dan knee flexion adalah 19.4. Jadi di sini kita dapati terdapat banyak perbezaan angle kerana 4 orang di antara ini tidak mempunyai pengalaman dan hanya seorang sahaja. Dan di table 2 adalah relative angle in the release phase, iaitu release bola. kita dapati bahawa range dia di antara elbow flexion adalah 50 dan knee flexion adalah 28.9. Kerana elbow apabila kita untuk riliskan bola, pergerakan elbow menjadi berubah tapi knee masih kekal. Dan ketiga adalah table relative angle in advanced motion phase, iaitu selepas fasa rilis bola dan akan berlakunya fasa advance ataupun motion lebihan, iaitu kita dapati di range tidak terdapat terlampau banyak perbezaan, iaitu untuk elbow flexion dah 38.6 dan juga knee flexion 24.8. Jadi kita teruskan dengan result yang seterusnya, iaitu next. Okay, table 4 tu highest and lowest speed of projectile. So di sini kita ukur daripada speed itu meter per second, 5 subjek kita. Subjek yang paling minimum speed ialah Aliyah, iaitu 1.97, dan paling maximum speed adalah 19.94 iaitu Daniel, dan low speed adalah 0.2 iaitu bila bola itu berhenti, sebelum berhenti, dan paling max adalah 0.75. Jadi kita dapati bahawa teknik dan juga bagaimana ia menggunakan power projectile itu menghasilkan the high speed dan the low speed end of ball. Jadi dekat sini range di antara adalah 17.9 dan untuk lower speed adalah 0.73. Okay, terus dengan discussion.
Okay, so for the discussion, we have 4 tables, in which is table 1, relative angles in the preface phase. In figure 1, meaning and elbow for the push timing in the preface phase, there was an average reading between 154 and 158 degrees for both angles. In table 2, no relative difference in the angles of all 5 subjects in the release phase, which is the knee flexion angle is 152 and 4 degrees. The elbow flexion angle average is 154 and 24 degrees. In table 2, we have average mean measured, knee of ankle flexion of working gait phases. So for the terminal swing for knee flexion is at its peak for the last phase of walking pattern, because this is due to the knee extension in the terminal swing phase to keep the step length during their walking and as the body's weight falls on the other limb too. Next, for the table 3, relative angles in the advanced motion phase. So the graph was drawn based on the average mean of the result from all the students. For the knee flexion is at its highest point during the final phase of the movement. So for the knee flexion, 149 and 58 degrees. Elbow flexion, 138 and 68 degrees. In table 4, we got the highest and lowest speed of projectile. All of the subjects' projectile speeds were similar if not identical. That none of the participants are class field hockey players, and the projectile speed is influenced by a wide range of parameters, including joint mobility, muscle strength, brain control, cognitive status, and the energy level.
For the conclusion is, the study shows that all players showed better push capabilities significant in ball speed, accuracy, and speed the drag. About the overall outcome, it's advised that we focus more on the angle of the arm, right leg, left leg, and distance of the leg created by subject when they make important impact with the ball and advance motion to increase the quality tap push, fundamental technique. This all subject creates when they release the ball with advanced motion, distance, speed when subject create to drag. Lastly, it shows by analyze and apply motion analysis can also improve sport performance. To develop a detailed descriptive biomechanic analysis of sport technique in hockey and establish the validity of coaching intervention measure of selected performance outcomes.
So that's all for my group's presentation for this time. Thank you. That's all.